Hi, I'm Dr. Mark Ortel, and I am working for Lawrence Endocrinology. Medicine struck me a little bit closer to home with an illness with my mother, so that really drove me towards medicine. And then later on, it really solidified when I was actually here at KU, working in a free health clinic and helping to care for the patients there and seeing the clinicians care for the patients, seeing their compassion. That really drove it home for me. Endocrinology came about early on in my internship in internal medicine. We would primarily take care of patients in a hospital setting with acute illnesses. It seems like a lot of these conditions we were treating were actually chronic conditions such as diabetes, and we're seeing the impact it can have, years down the road. As a specialist versus primary care, I can really focus on one or two conditions, whereas the primary care physician has to really focus on 10 different conditions, so that can be a little bit overwhelming during their office visits. When they refer over to see us in the endocrine clinic, we really can just focus on their thyroid condition, their osteoporosis, their type 2 or type 1 diabetes, and just really make that a focus of that office visit. So in that aspects, I think we can provide a lot of quality care that's more focused and personalized than what maybe a primary care physician could do when they need to address blood pressure, lung disease, heart conditions, you name it. My biggest advice for patients is to help their health between the office visits that we do have, and if you do have questions, give us a call back. We can't solve it in our office visit, but we can definitely put your right foot forward by giving resources to dietitian, exercise programs, gyms in the area to help treat their condition in another way. I would like for them to know that I'm a lifelong Kansan. I received all of my education here at KU from undergrad up into fellowship. So I've had quite a bit of my life here tied to Lawrence. Well, I think the residents of Lawrence and the communities surrounding Lawrence are very lucky. They have a very quality hospital right in their backyard, providing care with a lot of specialties that you can find in bigger communities, but it's so much closer to home. So it will save them travel, but also provide them the same quality of care you can find in the bigger communities. And I think if you come to LMH, you have more of a hometown feel. Actually, my daughter was born here in 2014, so we got to see how quality the resources, the nursing, the physicians, and everything about the care here. So I've had a firsthand relationship with that. My best advice for patients with their health is to take interest in it and be proactive. So if I don't answer all of their questions that they had during the office visit, they can always feel free to give us a call back. And also try to set them with their best foot forward going out of the office visit with resources in the community or the hospital that they could pursue to really help with their health care.